Hi all, welcome back to Nursing Group for another live sessions. So today, the last unit of sociology we are going to discuss. Okay, so the unit is that clinical psychology. Sorry, clinical sociology. Don't be forget, clinical sociology. This is one of the important unit. We are expecting 2 marks questions, multiple choice questions from this unit, or else we are expecting that there is a chance of getting the 5 marks question also. So if you are listening to this class, I would like to tell you that you are going to be exam oriented things, you are going to get it out here. And one more thing is that if you listen to this particular class, this is enough for your examination preparation. Why? Because all the things are we were included in this. So we will start our clinical sociology. Sorry. Why? Because I am telling psychology. Just now I am reading psychology, so that is why it coming like that. Don't be worried about that. So we will speak about the clinical sociology. What is this clinical sociology, my dear students? Have you heard about this clinical sociology? Sociology, we know that it is a study of society and people. Okay, so we are aware of this, and as well, what is this clinical sociology? So, in the practical way, we are supposed to understand the society by using the theoretical knowledge and researchers and the sociological research, and we have certain methodologies we were using to know the problem, we were using to know the problems of the society, and we are going to be provide a solution. We are going to resolve that solution by using the clinical sociology. Okay, so this topic is very important. So that is why in the BSc Nursing first semester we are going to study this clinical sociology in sociology subject, applied sociology, the last unit. Okay, don't be forget about this. This is the introduction part of this sociology, clinical sociology. Okay, so the clinical sociology is the practical field of the sociology. It is a practical field of the sociology. Okay, so this is a practical field of the sociology. Here you can see that uses a sociological theories, researches and methods to assess, prevent and resolve the social problems. Okay, so to assess, to identify the problem, to prevent, to we have to prevent the social problems, no? So that is why, and as well as we are going to resolve the problem. So this sociology, this clinical sociology was were going to be helpful for you to be resolve the social problems in the society. I hope you guys are understood the definition. So now we can see where it is focuses. It focuses applying sociological knowledge to improve the individual and community well-being. Okay, so to improve the individual and community well-being, which is going to be focuses more on the sociological knowledge to be improve the life of the people, individual as well as the community people. Okay, so that is why clinical sociology is very important and essential part of our society. Okay, so based on the practical, okay, so based on the practical theory, knowledge, research methods, we are going to be assess the problem, social problems, identify. Assess means identify. Okay, so we are going to identify the problem, we are going to be prevent the problem, we are going to be prevent, and meanwhile we are going to be resolve it. Okay, so we are going to be resolve this will be the very important part of the sociology. Okay, so understood, right? Now we can see the characteristics of this. Okay, so that is also very important. Either they may ask for the 2 marks question, characteristics. What is this characteristics? So characteristics are like features, okay, so we will call it as a features also, special features. So if you are going to be buy something else, you may go and ask the mobile shop to purchase the mobile, any special features are there in this cell phone, like that you used to ask, right? So the same way we have the characteristics for this clinical sociology. The first one is that works with individual, families and groups and organizations. So wherever you will go, you may experience lot of social problems. So one another, each other, we have to be work in a cooperative way, means this cooperation should be needed, the bond should be created, okay, so then only we can work each other in a good way. So if it is not possible, there may be a chance to get the conflicts. So in order to reduce that, this clinical sociology will going to be understand, okay, so which is going to be work with the individuals as well as families, groups and organizations. So this is very important. The next thing is focuses on social behavior, which is focusing on the social behavior, institutions and relationship, okay, so certain institutions will be there in our society, okay, so which is focuses on the behavior, social behavior, how it will be interact with other body, so that matters a lot, okay, so which is going to be interact with the social behavior. Next thing is that uses scientific methods like surveys, interviews and case studies, okay, which is going to be used the surveys, interviews and case studies, okay, understanding what I am telling. So to resolve any kind of thing, and it uses scientific practical field, means we are using the scientific data or the scientific knowledge to resolve any problem, right? So scientifically we are thinking in the clinical sociology, okay, so we are not going to be emotional, or you are not going to other parts to be think to resolve the problems in the society. So we are mainly focusing on the things which is very necessary, and which is we are going to be think in a scientific way to moderate or to mild the incidence of the severity of the incidence, okay, in the which means social problems, okay. Next thing emphasizes intervention, prevention and evaluation. So which is going to be emphasized on, which means worked on, like we have to be intervention in the sense that action, okay, so what we are doing, that is what intervention. And the prevention, okay, the prevention means we need to be curb the rate of incidence of any problem, okay, so or anything which may be interrupt or destruct the organization or the institution in the society. So understanding what I am telling, so this is also one of the characteristics. Next is that evaluation, okay, so the evaluation, okay, so it is going to be evaluate the problem. So this is the thing. Next one, helps in understand the social causes of illness like poverty, gender, roles, responsibilities, domestic violences, anything which will be there. So we need to understand the social causes of illness, why the illness has been came to this particular person. That understanding level should be matters a lot in nursing, so this is very important, okay. So various causes we have, like poverty is there, and we have gender, roles, so many factors, co-factors, risk factors will be there, okay. So those factors have like we need to understand which is going to be impact on this particular person health, okay. So that will be known by this clinical sociology. Next one is improves patient care by considering cultural and social factors, okay. So everybody is having a cultural diversity, and they are considering this patient care, which will going to be considered, yes, which will going to be considered, and we are working on the various cultural factors that may going to be improve the patient care, okay. So based on their modalities, we can change the modalities of the care providing to the patient. We are not supposed to give the things which is biased, okay, so that is not possible, but the providing care modality we can change, and we can give the treatment for the patient, okay. So the next one is that improves the patient care by considering cultural and social factors, okay. and 8th community based health planning, okay, which is going to be focuses on the community health. Community health. Why? Because there is a high risk rate of spreading from one person to another person. Easily the spreading will be there. So, in order to reduce the incidence of spreading of the diseases like any communicable diseases among the people, we are going to be use this clinical psychology, sociology knowledge to work on the community to reduce the incidence of the illness among the community people. Okay, understood, right? So, encourages holistic health interventions like biological, psychological, sociological or social. See, which means in holistic means what? Which is going to be focuses on the holistic health care. So, holistic means in all factors, okay, physical, psychological, and we have a social, okay, social. So, these three factors including, and it is focusing on the health of the individual. This will be given the knowledge and the clinical sociology. Next thing is that we have having a high blood pressure. So, the person has to take the regular medications for blood pressure, and he has to be monitor the blood pressure every time, okay. So, for this reason medicine he has to buy means he wants to pay the money, okay. So, that is why the patient is not taking the medications. The nurse has to identify this, okay. So, through asking the questions to the patient, and he can't afford it for the, like, by using clinical psychology, sociology, she or he can, the nurse can able to understand that the person is not able to buy the medicine, he can't able to afford it for the regular BP, like blood pressure, high blood pressure medications. So, what she can do? She can refer to the lower cost of medicines like Janata Aushadhi and all will be there, and less cost only we are getting the medications, okay. So, that is the thing which the nurse needs to understand, means this clinical sociology is very important to able to understand the social phenomena among the group or a individual or the family people in the society, okay. So, now we can move that the patient's family thinks traditional remedies are better, like that and all it will be there, okay. So, why I am telling? So, nurse needs to understand the criteria of the family members and the individual means the patient means she has to interact with them, right. She has to collect certain information from the data from the people. So, that will make sure that nurse can able to identify the problem why the person is not taking the high blood pressure medications, BP medications. Then she can able to give awareness to the people, yes, you have to take the medications. Why? Because if you are not taking, further complications you have to be suffer, okay. So, even if you are not having money for sufficient money to purchase, you can buy it with the low cost of money. You can take help of the government and benefit of the government medications facility, okay. So, and she can tell to the family members of the patient, family members, like she can explain them, it is not going to be worth what you are doing this home remedies, it is not going to be worthful for the blood pressure, this is clinically diagnosed, okay. So, she can go and explain to them, right. So, later on what will be happen, they can able to be understand, and they can able to provide the medications regularly, they can take and they can cure, they can live with the hypertension. So, this is why this clinical sociology is very important, okay. Next we will see that sociological strategies for developing services for the abused. Okay, so sociological strategies for developing services for the abused. So we have child abuse. Okay, so child abuse will be there, elderly abuse will be there, sexual abuse, so lot of abuses are drug abuses, lot of abuses will be there. So those abuses, how we are using the sociological strategies to develop the services for the abused. Okay, so what kind of services we can develop and give to them. Okay, so very first we have to provide a rehabilitative services for them. By knowing this clinical sociology, we can improve the health and mental health of the people, okay, in the society. So every day we are seeing a lot of people are underwent the abuse. Okay, so emotional abusers, okay, that we can discuss. So certain strategies will be there, my dear students. So those strategies we are discussing right now. So strategies used for abused people. Okay, so the first one is that needs assessment. Before that, victims of abuses like domestic violence, child abuse, elderly abuse, emotional abuses often suffer psychological trauma, social isolation, and stigma will be there. Clinical sociology will help in creating effective cultural appropriate accessible services. Okay, so it will, once the people or the individual or the group were going to underwent any kind of abuses, that may be going to be, which is like mental trauma we can see. Yes, of course, emotional abuse. See, one thing I would like to tell you, however the people will also, if you want to speak with them, speak. Okay, as a nurse, you don't want to judge them, you are not having a right to tell them how they are their external features. No need to tell. Okay, some people are taking in a positive way, some people are not having that kind of self concept to be take. So that will going to be affect their emotionally. If you are telling, suppose you are telling you are so fat, so dark, so don't tell those kind of things. Why you are going to be tell that? You are not having a single right to tell those kind of things, right? So why I am telling, if you saw that also, no issues. For them they are very beautiful, for them they are very nice. Why you are seeing that? So their happiness is important, their mental health is important. So who you are the person to go and hurt them? Okay, so that is why, that's what my question to the people who are telling like that. Okay, so as a nurse, you should not judge on of those external features or characteristics. So for you, everybody is the same. Okay, so in order to curb this, we are using the certain strategies. The first one is that needs assessment. Okay, so what are the needs assessment? So this is the needs assessment. Needs assessment identify the type and extent of abuse through surveys, interviews, and focuses on the groups, which means see, assessment is that for doing identification of the problem, right? So there we are doing the assessment for the identifying the problem, and we are mainly focusing on that the groups of people, as well as we are conducting through interviews and surveys we used to do. So these surveys and all will going to be help to collect the data from the abused people. That is the first strategy, that is needs assessment. Okay, the next one helps tailor services the actual needs of the targeted group. Okay, which is going to be helpful to tailor the actual needs of the particular group we can able to understood. So those who are abused, no, for them what is the actual need. So we are doing this assessment, we can able to understand that. That is the first strategy. Next we can see that community engagement. Okay, second one is community engagement. So this community engagement is that we are having involves the religious leaders, social workers, nurses and educators to raise the awareness and reduce stigma. Okay, so which will build the trust and support system in the community. Why? Because you know, in the community people there is a lack of literacy rate. Okay, so there are so many people are illiterate. So we are the social workers in the society. As a nurse, we need to take the initiative and we need to conduct lot of health campaigns and certain what we can say health education camps, and we used to conduct lot of awareness programs like digital detoxification among the people, and we are conducting lot of programs on breastfeeding. So like this kind of initiatives we have to be taken and we have to promote the health, so that if you are doing as a nurse, that will going to be make sure to build the trust among the people, and as well which is going to be helpful for the people to know about the particular health informations. Okay, so that will make sure to be build the community better. So that is the second strategy. Next one is multidisciplinary programs. Okay, so the third one is multidisciplinary programs. So multidisciplinary programs. What is this multidisciplinary program? Development of shelters, legal aid, medical help and counseling services under one umbrella. Collaborative approach with the healthcare, legal and social system. So for this multidisciplinary programs, we can conduct the shelter like in a development of the shelters for the people in the community, and we can able to provide a healthcare services at one roof. Okay, so that will going to be comes under the multidisciplinary programs. Okay, so next one is that culturally sensitive interventions. Okay, so the next one is culturally sensitive incident. So what is this culturally sensitive interventions? So the culturally sensitive interventions are design services respecting the cultural norms and values of victims, avoid a re-traumatization and victim blaming. Okay, so this is a culturally sensitive interventions. It is a design services, so we can able to be rehabilitate the victims, which means who are underwent abuse, no, so we can able to be reduce the incidence of the re-traumatization. Again they can't they will be not going to be the same phase. Okay, so they are not going to be traumatic or toxic. So in order to curb that, we can able to do this strategy, culturally sensitive interventions. Next one is victim empowerment. Victim empowerment. What is this victim empowerment? So we have to empower them while providing education, and while can providing the job for them, and we can train vocational training, we can provide life skills, we can teach them, and to help abused individuals to rebuild their life. Okay, so rehabilitative services which we can able to going to be give to the victims to rebuild, which means bring back. Rehabilitation means bring back. Okay, so that kind of services we can able to be provide for the victims to empower them again. Okay, so the next thing is that policy advocacy. Okay, so the next sixth strategy is that policy advocacy. Policy advocacy. So, hope you understood this one. Policy of advocacy is that clinical sociologists work with policymakers to strengthen laws, promote gender equality and fund anti-violence programs. Okay, so this policy advocacy means clinical sociologists work with the policy makers. Okay, so the clinical sociologist will be there, so they are going to work with the policy makers and they are going to be strengthen the laws. Okay, so they are going to be put a strength to the laws and they are going to be reduce the amount of abusers and which is going to be promote the gender equality and they are going to be fund the anti-violence programs. Okay, so gender inequality. So wives needs to be in the home, they has to be ask money from the husband. So those are things will be right now also it will be there. So nowadays the literacy rate of the women will be more and they are going to be working. Okay, so not like that. So these kind of advocacy, policy advocacy which will be there means by the time we can empower women, we are empower the people, we can able to be curb the gender inequality. Okay, we can promote the gender equality among the men and women. Okay, so this is the sixth strategy. Now we can see the role of nursing services for the abused. Okay, so who are abused? No, elderly abuser, emotional abuser, child abuser. For them, that the nurses often first line responders to the play a critical role in identifying, supporting and referring the victims of abuse. She has to be assessed and she has to be diagnosed what happened to them. So she has to be provide a support to them, then she can able to be help them and she can able to refer them. Okay, so this is the main role. So the first role is that early identification or screening. Okay, so the role of nurse we can see. Understood. The next thing is that we can say here providing medical and emotional support. Okay, so first we will discuss early identification. So that will be comes under the assessment. Okay, identification means assessment. We will assess the state of the abused people and like bruises, fracture. Okay, behavioral signs like fear, anxiety, withdrawal symptoms, or use of screening tools. Ask sensitive questions in privately. Okay, so lot of abuses which will be taken place. So in the identification we can able to ask the private questions, sensitive questions to the people in a private and they can be able to be answer for that and we can able to provide a care for those things also. So this is why the early identification and as well as the screening should be done. So there the role of nurse will be very important. Next one is providing a medical and emotional support. Offer first aid, emergency care and mental health support to the abused people. So and by empathetic and non-empathetic non-judgmental help, patients feel safe and believed to the nurses. So that is why the next one is providing medical and emotional support. Okay, so providing medical and emotional support. Okay, so understood, right? So here the next one is providing medical and emotional support. Next one, referrals to support services. Coordination with social workers, counselors and legal health, legal aid and shelters. Next one, ensure the continuity of care. So ensure this continuity of the care by proper documentation and follow up. Okay, referral and support services. Okay, third one is referral. So sometimes what it will be happen, so sexual abuse and all which will be taken for the child. Okay, so by the time we have to be sent for the public social shelters. Okay, so we need to be provide a emotional support, we need to be provide a referral services, we need to arrange a shelter for them. Okay, so those are also human beings, so we have to be support them. So they underwent abuse means uh, we should not be going to be like let it, you should not like that, you should not be irresponsible, you have to take the responsible and you have to take your chance. Next one is health education and empowerment. Okay, so all of this we have to be educate. Okay, so the next one is health education and we have to be empower them. Next one, participation in community awareness programs, advocacy and policy engagement. Okay, so participate in community awareness programs and we have to advocacy and policy engagement. Okay, so the next is that one scenario we can discuss. Okay, so how the nurse will be take a part in this abused. Okay, so means how she can able to provide a services as a clinical sociologist, how she can able to analyze. Okay, means example. Okay, scenario is one example, one situation we can take and we will explain. So a 30-year-old woman visits a community healthcare center with the complaints of frequent headache and body pain. While examining her, the nurse noticed bruises on her arms and observes that she seems fearful and avoids eye contact. Okay, so 130 a woman will come, she said that I am having a headache, that much only. While doing physical examination and all, the nurse can able to understand that the bruises will be on her arms and all will be there. So that one she observed, and otherwise that it seems to be she is very fearful. Okay, she can't able to make eye contact, you may see that. So somebody is crying, your friend, you see that she will not going to be see your eyes and cry. Okay, so this is the thing which will be, so the observation is very important. So she observed that. Now you tell that what she can able to do as a nurse, what you will do like that if you saw, but the patient is lying that I am having headache and body pain, what you will do? So here as a nurse gently asks her if she feels safe at home. Okay, we need to ask whether you are feel safe at your home. And woman confides that her husband often beats her and restricts her movement. The nurse comforts her and provides a medical care and explains her rights and options. She then refers to a woman to local women's shelter, a counselor and legal support services. The nurse also informs the hospital social worker and ensures a follow-up plan for women's safety. Okay, so if you saw like this kind of, okay, every home it will be there like that, no need to leave. Okay, so you educate them, you should not going to be abused, you are not there for abusing purpose. Okay, so you have to be explained. So the role of nurse in that, like identify the victim of abuse and offer medical and emotional support, refer the protective and rehabilitation services. So the nurse has to be confessed with that, she has to be skillful, she has to be understand the scenario, she has to be understand the modalities of providing further care. Okay, so that is the role of nurse. Okay, the next is that same like this only, lot of scenarios will come. Okay, So, use of clinical sociology in crisis intervention. So, like domestic violences will be happen by the time, or else we can see that suicidal behavior, natural disasters, sudden illness or death, child abuse or traumas, we can use this. Okay. So, the next one is that so the same thing, suicidal and all means early crisis identification will be there, and provide emotional and medical emergency care should be there, and refer appropriate social services or shelters, educate the individual or family about the available resources and legal rights, participate in the community outreach of the awareness program. Okay. So, this is the thing. So, then now we can see the nursing actions. Okay. So, scenario I have explained. Now, next one is nursing actions. What she can do in certain situations. Okay. So, this and clinical sociology principles we will call as nurses actions using clinical sociology principles. The first one is immediate medical and emotional support, that you know already. Next one, social assessment, sociologically she has to assess, identify. Then crisis intervention, contacts the hospital social worker for the further action. Crisis intervention, what she can do, she can call the social worker in the hospital, and she can arrange the shelter for the abused one. She can provide a legal advisors, like tell about her rights. Okay, tell about her rights, and family also she can tell them. Next one is empowerment and support. Okay, so empowerment and support she can do, explains the legal rights and availability, welfare schemes and safety planning, assist in contacting to her and counselor, and schedule follow up visit. Next one is team coordination. Team coordination will be going to be helpful by using this sociological clinical sociology principles. Okay, so clinically she can able to be ensure continuity of care and future protocols for the abused people. So, this is the thing. Okay. Clinical sociology in action means the nurse used sociological understanding, assess the environment of the patient, and she applied the intervention strategies. Okay. So, that is what she is doing. So, that is why this is the important thing. Okay. So, sociological strategies for developing services for abused means child abuse, pedophilia, physical abuse, child neglect, emotional neglect, all these things will be there. Okay. So, the factors which will be like family stress, poverty, okay, unemployment, all these things will going to be cause this abuses. So those abuses we should not going to be leave like that only. We have to be rebuild the life of the individual. Okay, so that is why she is using the strategies like early identification. That's what we have discussed. No, and she is going to be legal advice, assistance. She going to be give. She can referral services. She is doing. Okay, so those are the strategies she is used to provide a emergency and medical care for the abused people and rebuild their life. Okay, so those are the roles and responsibilities. Okay, so in each and everything, this is the thing. She can go and empower them. She can go and awareness. We can give awareness community programs. We can conduct and aware the people. So nobody should not going to be. And after that, she can be get the information gathering, and she can able to give a direction to the people and progress assessment. Okay, whatever the things which will be happen, she can able to arrange the counselor and all, or shelter, legal advisors, everybody she can arrange, and she can team coordination she can do. She can call the social worker in the hospital. She can arrange all these things for the abused people. Okay, so here the main abuses, child abuse, women abuse, elderly abuses will be come. Okay, so for them each and everybody, this is the criteria nurse can able to do. Okay, so that scenario I have explained. No, so that is why the clinical sociology is very important to the nurses to provide provide rehabilitative care for the abused people. Okay, so this much if you know means this is the modalities, so this unit will going to be cover it off. Okay, so a little bit you have to focus on the abuses. Okay, thank you for watching, and we are going to be wind up your sociology. So hope you guys are understood this clinical sociology. If you have any doubt, you can ask us. We will already started our examination preparation, and as well as we have started the important question series. So there you will get the questions. If you study that one, you will definitely pass it off. Okay, thank you so much for watching.